Right. So if you have read and understood, considering its surgical pathology station, kindly please tell me what would you reply to the patient, considering the PSA levels, which patient is concerned about?
Okay. You mean the diagnosis, ma'am, or?
Yes.
Yeah. Okay. It's most probably prostatic cancer.
Okay.
Also, I consider it the differential.
Considering prostatic carcinoma, how diagnosis is established?
Okay, I will go for transrectal biopsy with ultrasound and send it to histopathology and immunohistochemical test.
Yes.
And also do a CT scan for staging of the cancer, and also do blood test for tumor markers.
Which blood test?
Okay, already I have BCA. I will go for lactate dehydrogenase levels, and alkaline phosphatase level, and also I will do CBC and
Calcium levels.
calcium
Most important.
levels. Yeah,
Yes.
calcium levels.
Because if you are
Yes.
considering carcinoma, then you have to consider
Yeah, hypercalcemia. Yeah.
yes, hypercalcemia. Okay. Can you please tell me why is it necessary to collect multiple biopsies in order to establish your diagnosis?
Because the needle biopsy, it is like small needle for this test, like scanty amount of tissue to examine. So we need multiple tissue, multiple injection to take amount of the tissue, and also it could be the tumor cells mimic to the normal tissue. So also we will not take the biopsy from all the lobules of the prostate to don't miss the diagnosis, and because like sometimes that abuse.
Once you have taken the biopsy, how would you differentiate or how would you confirm that biopsy has been taken from the prostatic part, not from the rectal part?
Okay, we can do CAA for rectal rectal exclusion, and BCA for prostatic. Also, we can do another thing. I couldn't remember it for prostate.
Immunohistochemical marker.
Yeah, immunohistochemical for BCA and CIA.
Okay, can you please tell me what is the grading system which is used in order to confirm that or describe the or classify the prostatic carcinoma?
We have Gleason grading system.
Yes, please.
From 1 to 10, and we have like 5 levels of the tissue, from the well differentiated to poor differentiated. I will take the first pathological histology, and the second, and I sum the result, and if the result from 8 or from above the 8, this will be considering prostatic cancer.
What are the genes, can you please tell me, which are involved in the pathogenesis of prostatic carcinoma?
Okay, we have PTEN gene and TSL gene, 2 gene.
No.
Okay, just 1 second. We have
we can come back to this one later.
Yeah, okay.
Can you please tell me what management can you offer to this patient?
Okay, according to after MDT meeting and the staging and grading, then we can go for prostatectomy, and if the tumor has metastasis, then we can go for chemotherapy and radiotherapy.
How would you reassure that prostatectomy, radical prostatectomy that you have done has been successful?
Okay, I will check the level of BSA. It will be down after the operation
How
because
long?
it is
How long? After how
from
long?
4 to 6 weeks after the
After,
operation should
yes.
be
Good.
like shut down.
Okay. But this PSA levels, they are not reliable. Why?
Because it is organ specific, not disease specific. It is, could be elevated in benign prostatic hyperplasia or in ejaculation or in many things can be elevated or proctitis. So we
Even
cannot
in
rely
case
on
of,
it.
yes, exercise and DRE,
Yeah.
when you do the direct digital examination. Okay. Right. This same PSA after radical prostatectomy, 6 months, comes
Mm.
out to be 3. What would you think?
Could be the tumor not remove it, all the tumor or recurrence of the cancer.
Okay. What is the most common site of bone metastasis?
Spinal
Okay.
to the spinal vertebrae, lumbar
Yeah,
vertebrae.
vertebrae. Okay. Yes. Okay. Right. What is the type of mets that you see on imaging?
It will be a sclerotic type of.
Okay. Have you heard of like sclerotic site on the skull? So it's not just the vertebra, it's the skull as well. So can you please tell me what is the mode of spread of prostatic carcinoma?
Okay, it will be spread to by the lymph node to para-aortic lymph node and by blood to hematogenous to the spinal vertebrae because the vein no valve, and also could be to the lung and
Lungs, okay.
yeah.
Right. It is often thought that there is a benefit of doing bilateral orchidectomy while treating patient with prostatic carcinoma. Kindly comment on it.
Yeah, because we need to androgen deprivation from the body
Yeah.
because it's a precursor of testosterone. So we can will stop the growth of the tumor when we do orchidectomy, prevent the increase the size and the growth of the tumor cells.
Okay. Good, Belvent. Okay, post-operatively, right, patient comes and patient has fever, dusky red urine. What would you think or what would you suspect?
Okay, it could be hematoma from the surgery or UTI
UTI.
after the
If
surgery.
you think it's a urinary tract infection, what is the most common organism that you
Gram negative E. coli.
Yeah, E. coli. Very good. Good. Okay, thank you.
Back to the question. I forget it.
Yeah.